Okay, I think we're doing this. Welcome to whoever decided to stick around. 10 minutes late, better late than never. I don't know what I was thinking to try my very first live on the last night of school before Christmas break. Like, I thought we wouldn't go to bed late and be just fully wired, but I did it. So I'm hoping somebody will join us, but if not, we'll just get into it. So I'm Dara. I am a physical therapist, a mom of two, a dog mom, a um, a reader, an exerciser, a back pain sufferer. I've got it all. So questions that I think come up pretty often when we talk about physical therapy. Let's start there. Um, wow, I wish I'd seen you sooner. Um, I think is probably the number one. People ignore their pain and they ignore their pain and they ignore their pain until it becomes this huge problem, and it can be fixable really quickly. Um, if we get at it really quickly, it can be fixable. If we can get our hands on you and we can figure out what you did, the human body really is its happiest when it's where it should be. And a lot of times the injuries we create for ourselves happen from repetitive use when we're doing things like picking up a kid and carrying them on our hips for 3 to 5 years, or carrying laundry and a kid, or doing an insane amount of yard work in a 5 hour window. And that repetitive motion, that raking, that shoveling, that pushing the lawnmower over and over and over, these things can give us trouble. And so I think if we can get on them right away, we can solve them. They don't become big problems. If we don't get them the right away, then they become chronic back pain, chronic shoulder pain, rotator cuff tears, nerve pain in your feet that you think, well, okay, I'm just over 40 and now my feet tingle when I wake up in the morning, or the first few steps out of bed are always just rough. And that's not the case. A lot of times it comes hand in hand with just an overuse injury. We get busy, we have kids, we forget that our bodies are doing things that they've never done before. When you think about carrying a pregnancy, you build on the front of your body for a long time, and then you have a child, and then you have to carry that child, and your body doesn't have the time to heal. And that's okay. That's the way that it is. But we have to give ourselves the opportunity to respect that space, but also realize that we can get on it. Something that we do at Seacoast Mobile Physical Therapy is that we can just go to you. Um, we can go to your house. We can help you through your problems. We can get you to where you need to be without you having to spend that exorbitant amount of time driving to the physical therapy clinic, waiting for a physical therapist, being co-treated with other patients in the same space. We have the opportunity to really listen to our people and really see them in their environment and see what they're doing. Being a mom of two, I can also wait for a hot minute while you change diaper or get a snack or all of those things. My husband's been working from home for 2 years. I understand what it's like to be a dynamic parent in a situation where your kids are home and your spouse is home. And all of the things that come up when you live a dynamic life, and especially in a pandemic. But all of those things are adjustable, and that's why we do the home visits, is so that we can see people in their own spaces in their own time and make sure that we save their time for them, and that we can actually spend that one-on-one time with people, so they get better. It looks like we've got a couple people. Hi guys, do you have any questions for me? Thanks for joining. Just figuring it out. Let's see. What were a couple of the questions that I had this week on the group? Somebody had a question about core and what the core is. People said, strengthen your core, strengthen your core. And I think a lot of times we think Abdominal muscles are what the core means, but the abdominal muscles are just, no, Val, I'm not bringing more cookies. See, look at that. Cookies from your therapist. What can I say? So your abdominal muscles are just one part of your core. When you think about the human spine, sits here and it's got a 3-point brace. So you have your abdominal muscles in the front, and you have your shoulder blades in the back, and your bum, and those are sort of your three big movers. So they put pressure on your spine to stabilize it, and that's what really helps move your body. Those are the big lifters, the movers. And so when we talk about strengthening the core, if you have that forward shoulder posture, if you have that dip in your low back from sort of sticking your bum out and shortening those muscles too much, then you're really just focusing on your abdominals, which is a really good area to have strong, specifically the transverse abdominis, so sort of that wrapping muscle that goes around you, almost like an internal corset. But if your abdominals are strong, but your shoulders are forward and you're flexed forward at your hips, then you're not going to be able to appropriately strengthen those two back braces. So you're very strong in the front, but you're weak in the back, and you get your curvature misplaced. And when your body is not the way that it should be, you can have trouble with all sorts of things: shoulder pain, hip pain, knee pain, ankle pain, when your spine isn't supported appropriately. So a couple really good basic core exercises. Anything that opens up your shoulders. So you can do rows, you can do lat pull downs, anything where you're opening your chest up will get you out of that computer posture where you're sort of hunched in on it. Anything with your butt muscles. Bridges are a super easy one. Make sure that you have your heels close up to your butt. If you can feel it behind your thigh, in your hamstrings, you're probably using your hamstrings more than your butt muscles. So scoot your feet closer to your butt and make sure that you really drive up through your heels, so you're using your core and you're using your glutes to do that. Um, and then planking. Planking is a really great total core muscle exercise. If it hurts your shoulders, you can always adjust your palms coming externally rotated. You want to keep your hands in a straight line with your shoulder. You don't want to be too far out, because then you don't get all of that good body support. You really want to make sure that you're over your arm. You can plank on your knees. You can plank on an incline. So if you have like a kitchen counter and you want to start doing planks there, that's a really good beginner plank position. And as you increase your gravity, as you get closer to the ground, you engage your muscles in a very different way. There's no bad way to plank, and it does use your shoulder blades, your glutes, and your abdominal muscles. What was the other question we had this week? Was oh, it's not coming to me. I think it was just, how do I move when when I'm sitting at my desk all day? What are good ways to sort of break that up? And so I think a good way to break that up would be, you can always do chair stretches. So you can just reach over, grab behind your chair, pull on your elbow, stretch out your mid back. Same to the other side. That's a good one. Always opening your shoulders is a great way to stretch. You can stretch over this and a little over that. Anything that gets you up and moving at least once an hour is good for you, because we sit in this sort of bent position, preferably with your feet flat on the floor and your legs at 90-90 is the best support for your low back. But you're sitting all day, which means your ankles are bent, your knees are bent, your hips are bent, your low back is not supported as well as it can be, and most likely you're hunched forward over your computer. And so it's a really great idea to get up at least once an hour and just open everything up. So get up, stretch your hips out, do a runner stretch, put your foot up on a chair and just open that hip out, and open your chest. Get a doorway stretch, so hands on the side of the doorway, lean in, open your pecs up. Yeah, I'm just going to comment, I need reminders during the day to move at my desk. For anybody who has an exercise tracker on their wrist, that's a great That's a great reminder. I mean, mine will tell me to stand up when it's time to stand up. If you don't have something like that, set a reminder on your phone, set a reminder on your computer, tell your husband or wife to poke you. Have kids, they're great. They won't let you sit for more than 20, 30 seconds at a time. All right, let's see. We got a question here. My knee swells after I walk my dog. Should I wear a brace? That totally depends on what part of your knee is swelling, how far you're walking, and if it hurts. So that I would need to get my hands on it. Um, Ice after you go for a walk. Um, it depends on where, yeah, it depends on where it's swelling. So if you have like a compression sleeve that you could wear during the walk that helps reduce the swelling, or control the swelling so that it doesn't happen, that might be beneficial in the interim. But I would say, um, let's get that checked out because I'm not sure where it's swelling or what's happening. So a little compression sleeve might do the trick in the interim until you can get it checked out. And ice after you walk if that seems to be a problem. And again, reminders, stick a big note somewhere where you can see it. Um, and a click in your kneecap. I think we need to talk. We need to talk. Um, yeah, print off, go on Canva, print yourself off a big sign that says get up and do it. Um, Print off some stretches. I think I put some in the group, so that should be helpful. Um, yeah. So let's see. What else? What else can I answer? What else can I tell you about me? Um, I I love being a physical therapist. I love sharing the knowledge that I have about the human body and about how we can feel better and do better and know better, um, about our own bodies, about how to heal ourselves from injury and pain. Um, I have a physical therapist that I see when I hurt myself because I can't I can't fix myself. Even with all the knowledge that I have, I think having a physical therapist in your corner is invaluable, to all the things that life throws at us, especially with the sort of incredible circumstances we've had in the last few years. Our bodies are going to need some love coming out of this, um, and getting us back into the real world and into mobility again. And I think, it never hurts to get checked out by a physical therapist. It never hurts to fix your aches and pains before they get too big. And I am happy to help. I'm happy to be here and answer questions, and get people back to where they want to be in life because there's absolutely no reason that any of us should have to sort of kick that can down the road for any longer. I think we should just get on it, get it fixed, get the tools we need to fix ourselves when it comes up again because inevitably we do those repetitive injuries. And things come up again. But if you have the tools in your toolbox to fix it right away and make sure that it doesn't happen again, it's so much easier, um, to deal with it that way. So I think that is going to be it for tonight for my very first live. For my super amazing computer skills that only put me 10 minutes late and bedtime on vacation night. Thank you guys for signing in and interacting with this. And tell your friends, join the group. I'm here. I'm going to answer questions every week. We're going to try this again in 2 weeks. Next week I'm on vacation. The kids are home. So I will be doing puzzles and coloring all week. But I'm always happy to answer questions. If you have any questions that come up, throw them in the group. I will check it this week, and I will happily get you answers that hopefully will get you on the road to feeling better. If not, we can talk more about getting you some hands-on care. Thank you guys. Have an awesome night. Have an awesome holiday. If your kids are home for the week, big breaths, lots of wine, and be safe. Thanks, guys.